Hello friends, my name is Harsh and I am from Principal K.M. Kunnani Pharmacy Polytechnic Ulhasnagar, and today I am sharing some information about tuberculosis. What is tuberculosis? Tuberculosis is defined as an infectious disease caused by a bacterium that most commonly affects the lungs. It can also be a crippling and deadly disease and is on the rise in both developed and developing worlds. Globally, it is the leading cause of deaths resulting from a single infectious disease. Currently, it kills 3 million people a year and could claim up to 30 million lives if not controlled. How is TB spread? Aristotle was the first to say that tuberculosis is an airborne disease able to be passed from one person to another. Although his theory was correct, scientists continued to search for different causes and treatment of TB. In 1865, Jean-Antoine William put out the idea that TB was genetically inherited. This gave a sound peace of mind for all until 1882 when Robert Koch proved her wrong by discovering a round-shaped bacterium that was the cause of the disease. This excited the scientist world as it brought the possibility to cure humanity's deadliest enemy. What are the types of tuberculosis? Mycobacterium, which is carried by humans. Mycobacterium TB can present itself in the human body in different forms, affecting anywhere from the intestines, bones, joints, skins, and the genitourinary, lymphatic, and nervous system. Avian tuberculosis. Avian, which is carried by birds, transmitted by ingestion and inhalation of aerosolized infectious organisms from feces. Oral ingestion of food and water contaminated with feces is the most common method of infection. Once ingested, the organism spreads throughout the bird's body and is shed in large number of feces. If the bacterium is inhaled, pulmonary lesions and skin infections may occur. Transmission of avian TB is from bird to human, not from human to human. Bovine tuberculosis. Bovine tuberculosis is carried by cattle. People contract bovine TB today by eating food that has been contaminated by the bacteria or from drinking unpasteurized milk from cows that are infected with the virus. Bovine TB is most likely going to affect the joints and bones. Now we are seeing symptoms of tuberculosis. The primary stage of the disease may be symptom free, or the individual may experience a flu like illness. This is called the inactive active stage. Within the active stage of the disease, there might be a slight fever, night sweats, weight loss, fatigue. The symptoms may vary depending on what type of tuberculosis you contract. Now, physical symptoms. This is an example of tuberculosis of the skin. It is normally referred to as VTTB, and someone will only contract this type of tuberculosis if they have had prior exposure to tuberculosis. Get tested. When someone comes into contact with tuberculosis or feels as if they become infected by tuberculosis, they should call a doctor and order a skin test. The doctor will inject a small amount of tuberculin under the skin. If a skin has been exposed to tuberculosis, a swelling will develop around the spot where the skin test is given. Treatment. We are seeing treatment of TB. If your TB skin test comes back positive, your doctor will take one of several treatments to treat you. Your doctor may prescribe a medicine called isoniazid to prevent the tuberculosis infection from developing into the active disease and making you feel sick. If you contract TB of the abdominal or of the extrapulmonary, you may have the choice of a mainstay therapy that takes a course of 9 to 12 months in order to complete. Surgery is generally reserved for patients with obstruction of vital organs. Continued. No treatment at all since most people develop an immune response and warts go away by themselves. If your warts don't disappear or if uncomfortable, first choice remedy should be over the counter medication in liquid. gel, pad, or ointment form. If over-the-counter treatment fails, your doctor can remove a wart by freezing it with liquid nitrogen, burning it off with electricity or a laser, excising it, a minor surgical procedure, dissolving it by wrapping it in a plaster patch impregnated with salicylic acid. Interview: Susan Pathe, a nurse practitioner at Sandpoint's Pediatrics Clinic, gave a few pointers on prevention of tuberculosis. She said that avoiding close contact with someone who has or may have TB is the first way to prevent yourself from contracting it. Regular exercise and a good diet is the best way to keep your immune system up in order to fight off the inactive TB germs. Susan Pathe concluded you are most likely to contract tuberculosis from someone that are you in daily contact with, like a co-worker, classmate, friend, or family member. Review: what causes TB? Bacterium that most commonly affects the lungs. How many people can it affect if not controlled? 3 million people can affect if not controlled. How does it spread? Airborne disease able to be passed from one person to another. Name any one type of tuberculosis: avian, bovine, and mycobacterium. Name two non-physical symptoms of TB. Slight fever, night sweats, weight loss, and fatigue can be the physical symptoms of TB. And the reference is here with all of dates and links. If you want some, you can go and type this link and take all information about that what I have given in that video.